Okay, so now I'm in the room, knock on the door. Hi, Miss Stevens. My name is Megan. I'm going to be your nurse today. Before I begin, can you please tell me your name and your birthday? And she says, Gladys Stevens, 216XX. Wonderful. Miss Stevens, do you have any allergies anywhere? And she says, no. And are you experiencing any pain? And she says she's not having any pain, but she is feeling very nauseous and she's been vomiting all morning. So that's consistent with what we know that the patient has a small bowel obstruction and nothing's getting through. So we're putting in the tube to help relieve with that. So to the patient, we'll explain, Miss Gladys, your physician's ordered for me to put in an NG tube. An NG tube is a tube that'll go from your nose down to your stomach, and it's going to constantly remove the gastric secretions that are in your stomach, and it will help relieve some of that nausea. So it's not going to be a very comfortable experience putting it in, but most patients do say that they feel better after because that nausea and the vomiting will go away. Do you have any questions for me regarding this procedure? And she says no. So I'm going to go ahead and begin by assessing the patency of her nares. So I'll ask her, Miss Gladys, have you ever had nasal surgery? Do you know if you have a deviated septum or a skull fracture? She says no. So what you're going to do is have her cover each nostril and breathe out each side to determine if she has any congestion and to see which of the two nostrils is more patent. I'm going to take my flashlight and look in there as well and make sure that I don't see anything and everything looks great. I don't see any bleeding, any congestion, they look patent. The next step that I'm going to do is go ahead and measure my tube, how far that I'll need to place it so that I ensure that I'm in her stomach. So what you're going to do is measure the tip of the toe, the tip of the tube to her earlobe, and then down to the xiphoid process in her stomach. So this is how far that my tube will need to go in. And what I'll do is I'll mark that with a small piece of tape so that I know how far to push it in. Now, some of these tubes have numbers on them. This one does not. You could also just remember if it was like the number 55 that you would push until you saw 55 right by her nair.